Hello everyone, Dr. Naveen here from UPSC MEDICO. In this video, we'll be discussing the UPSC Civil Service Examination 2022 Medical Science Optional, the final paper analysis. So this time I'll be doing this paper in a subject-wise manner, starting from paper 1 subjects like anatomy, biochemistry and physiology. While doing subject-wise fashion, I'll be giving you what are all the previous year questions which were asked, which were repeated, and also what should be the future strategy for 2023-24 batch, because it is very important to understand and analyze previous year question paper. Based on that, you have to kind of route your preparation, right? The direction should be in the lines of PYQ centric, especially for UPSC exams. So we'll be doing that in a subject wise fashion. Let's begin with paper 1 section A anatomy, and the weightage was 75 marks, okay, usual and predictable, and most of the questions from anatomy are repeats. So overall paper 1, including the static subjects like anatomy, biochemistry and also physiology, path, micro, forensic and pharma, almost the entire paper was a repeat paper with previous year questions, and also it's usually predictable and easy in comparison to paper 2. Overall, paper 2 was, there's nothing out of the box. The questions were within the purview of the syllabus in paper 2, but paper 2, understanding the body of the question was a bit tricky. Otherwise, the answers are the same. Only thing is, in comparison to paper 1, paper 2 was tricky, and paper 2 was the area where few of the aspirants kind of faced little difficulty. We'll try to address that issue, and also I'll make sure that how to go ahead with paper 2 in the future. Okay, so these are the things I'll cover. Starting with anatomy, we have a question on stomach, okay, under the headings like peritoneal relations, blood supply and lymphatic drainage, with a 15-mark weightage. Focus on the weightage, because this time most of the questions, though they are simple, their weightage is high. For example, there is a question on the significance of stress reflex in case of physiology. We will be giving 2 marks or 3 marks, but again they gave a weightage of 15 marks to a question of stress reflex as a whole. So when you're writing answers to a question, you should look at the weightage and you have to answer as per weightage of the question. This is what I tell all my test series students while evaluation and while also giving them the feedback and tips. It is very important to look at the weightage of the question and answer accordingly. What I feel is, if it is for 5 marks, there should be at least 5 keywords, okay, and you should be filling up one side of a paper. If it is for 10 marks, I expect at least 10 keywords highlighted in your answer. If it is 15 marks to 20 marks, I need a proper introduction, proper conclusion, and also you have to kind of give more content which is even not asked in the question. For example, here they simply gave peritoneal, blood supply, lymphatic drainage, but I expect you to write the clinical aspects of all these things. For example, why it is important to look at lymphatic drainage of the stomach, because in Japan they do even lymph node dissection for curing. Okay, usually what we pursue is, if there is a lymphatic metastasis or if there is a lymphatic spread in a cancer, it is incurable. But in Japan, they are doing gastrectomy with lymphadenectomy, which is curable, and they have kind of classified the lymph nodes into different stations. If you can give the clinical or applied aspect in case of anatomy for a question with more than 10 marks weightage, even if it is not asked, you are at a bigger advantage in comparison to your competition. So that is what I expect. So 15 marks, 20 marks, even for 10 marks also, give some points which are not even there, are not even asked, just to fill up the paper and give more content. Okay, so look at the weightage of the question in the future exam. That is very important. And yes, the stomach is a important topic from anatomy, and as you can see, there was similar question in 2015 and 2019. Okay, it's a direct repeat. Now you have developmental anomalies of kidney and ureter. I could see while evaluating test series papers, many of the students are facing difficulty with embryology part of anatomy. It's not that it's tough, the only thing is they're underestimating the importance of developmental aspects, that too the defects associated with them. And defects are, I could say, anomalies. So I want you to kind of revise all the developmental anomalies which are given in the syllabus, that to embryology part. We have a separate discussion on embryology in the video course. Be thorough with embryology part. So in that, it is definitely kidney was there in the syllabus, but ureter was not mentioned. Definitely ureter was, but overall genital system, okay, genitourinary system anomalies are important for future prospects. Genitourinary anomalies, okay, kidney and the ureters. And we did ask a question on horseshoe kidney in our test series this year. Okay, so developmental anomalies of kidney, more important one is horseshoe kidney. If you can elaborate it, you will definitely get. And look at the weightage, it's only for 5 marks. Similar questions were asked in 2003, 10 and 2020. Embryological basis of horseshoe kidney, development of the kidney, and also development with anomalies. Okay, yeah, focus on these aspects. Next question, the third question from anatomy point is physiological functions of placental hormones. Now this question is a kind of, I say, horizontal integration and I say vertical integration. Usually I use these words. What is horizontal? Within first year, if there is a question which is linked to anatomy, physiology and biochemistry, it is a horizontal integration. What is vertical? If anatomy is linked to general surgery, if physiology is linked to medicine, these kind of things are vertically integrated. Paper 1 to paper 2 are section A to section B. So these kind of questions are vertically integrated. I personally feel this question as horizontally integrated between anatomy and physiology, because in the syllabus of anatomy, placenta, the development of placenta and developmental anomalies was there, but in physiology, physiology of reproduction and menstruation are very important. Within the physiology of reproduction, the placental hormones, they play an important role during the growth of the baby, right? So how they help, what is the role and all is the placental hormone. So it's clearly, it's a physiological question, but we did discuss the functions of placental hormones in anatomy, and it's very kind of dictum question from anatomy is placenta. You look at the structure and functions of placenta, formation and its anomalies, functions of placenta, morphological features of placenta, 5 congenital malformations of the placenta, name the functions of placenta, list malformations of, see, almost ranging from 2000 to 2020, we have lot many questions from the placenta. Now look at the weightage. If I can tell you that placenta helps in synthesis of beta HCG by syncytial trophoblast, placenta helps in synthesis of human placental lactogen, which can be added. See, these kind of simple statements will not give you 10 marks. You should be able to elaborate it. That's the problem here. Like 5 to 6 marks at least you can answer, but at the end of the day they are asking you what are the physiological functions of placental hormones in pregnancy. So what beta HCG does, what what is human placental lactogen role and all, you have to elaborate that in this question. But it's a predictable question. Even if you answer what are the hormones and what are the functions in brief, you will definitely get 6 to 7 marks in this particular question. Now you have a core anatomy question. What is the anatomy of uterus? And very important one, the applied aspects are crucial in anatomy. Gross, relations, ligaments and supports, blood supply and lymphatic drainage. Similar questions were asked in 2001, 2015 and 2011. Okay, the same subheadings. Now you have facial nerve. 1 cranial nerve is a must. Okay, starting from cranial nerve 1 to cranial nerve 12. The highest or most frequently repeated cranial nerve was the facial nerve. Okay, you see 2007, 14, 10 and 2019. There's so many questions from facial nerve, and nowadays even in 2021 paper also there is a detailed general question on what are the functional components of all the cranial nerves was asked. So these days in the last 3-4 years I could see this new heading called functional components, which is general visceral afferent, somatic visceral afferent, general visceral SSA. So these afferents and efferents, general visceral or general somatic, or special visceral or special somatic, these headings are gaining lot more importance nowadays. Okay, so from the Vishram Singh neuroanatomy textbook we have good images. Okay, and even in 2021 paper notes also it was clearly given all the cranial nerves and on their functional components in the notes. Please go through them. This is very important. Maybe next year you might expect a question on trigeminal nerve. So after that you might expect a question on oculomotor nerve. But again, most important now what we discuss is facial nerve, because it is frequently getting repeated. Okay, so it's asked for 10 marks and these are the headings. Now you have next question on shoulder joint. So joints, for example, if there are two topics I want to pick from anatomy which are frequent repeats, one is placenta, other is facial nerve, and the third topic what I want to pick is the shoulder, any joint, be it be shoulder. If it is shoulder this time, next time they might ask hip, after that they might ask knee. So joints are very important. So realizing the importance of this topic itself, instead of routine questions in the test series, I tried to ask you what are the bursa around the shoulder joint, and what are the supports of the shoulder joint, right? There were different questions in the shoulder joint segment. This is again important. What are the rotator cuff muscles of the shoulder joint? What is their applied aspects? Okay. So now when you read about the shoulder joint, don't just stop at the regular headings like what is the type, surface, movements, muscles. Okay. Focus more on clinical aspects. For example, next time they might ask you dislocation of hip, which is very important from hip joint, right? Dislocation, hip dislocation, posterior dislocation of hip, anterior dislocation of hip from hip point of view. And from knee point of view, you need to understand the tests for what are the different tests which are available to test the strength of the ligaments, menisci within the knee joint. Okay, focus on that aspect because knee joint pain and knee ligament injuries are very common clinically. So focus on applied aspects of these joints. They might be the future prospects for the question. Okay, so joints, shoulder joint, hip joint and knee joint are the three joints which are there in the syllabus, and one question is a must. This time they went a little kind of more into clinical, and weightage is also less, only for 5 marks, but usually you expect a 20-mark question from the joints from anatomy. Again, lymphatic drainage of mammary gland, so many times the question got repeated. You see, it's very important. If a lymph node, if there is an axillary lymphadenopathy in a case of breast carcinoma, it carries worse prognosis because lymphatic spread means there's no cure, right? So definitely from mammary gland point of view, what are the stations or what are the levels of axillary lymph nodes which get affected is very important. What is its clinical significance? You might give sentinel lymph node mapping method. This was asked in 2020 itself. It's a recent repeat again. Okay, so the breast or mammary gland anatomy with clinical aspects, mainly focusing on lymphatic drainage, is very important. Now describe development of interventricular septum. Okay, this was the question direct from test series in the anatomy test number 4. We did ask about interatrial septum and interventricular septum and what is ventricular septal defect, okay, or VSD. Very important one from the embryology of the heart. I could see there are three or more questions from embryology, like you have interventricular septum, you also have the kidney and the ureter part, you also have the one more from the placenta. So embryology carries good weightage in the anatomy part. And very important thing I want to tell you from anatomy point of view is anatomy means images or diagrams. Okay, even if you fail to give any text, okay, even if you forget movements of the joints, the muscles producing the movements, relations and all, make sure that you practice at least 50 to 100 high yield images from anatomy and go to the exam. Okay, you have to draw images in this medical science paper, and that too, those diagrams should be in bulk in case of anatomy. Okay, and this is 70-mark paper and everything is a repeat. There is no outlier or any bouncer question from anatomy point of view. So in future, focus on the cranial nerve functional components, very important. In future, focus on the clinical aspects of the joint, which are very important. And in future, also focus on the developmental anomalies of the embryology part. Okay, developmental anomalies of the embryology part, and also practice images. This is what you take home from anatomy point of view. Why this is important? Because when an examiner is about to set new paper for 2023-24, he will be analyzing the previous year question papers and he will be kind of giving a question which is very close or pretty close to the pattern which is given in the recent exam. So understanding this paper, it forms a basis or strategy for the future preparation, right? So this is very important. Now let's quickly jump to biochemistry. Biochemistry, we all know there are few subjects in medical science optional which are high yield. For example, dermatology also almost carries 50 marks of the weightage, but there are only 6 or 7 topics. Similarly, biochemistry is also very high yield subject because you will get 50 marks if you read only 4 aspects. One is organ function test, other is vitamins and minerals, that is nutrition part, other is tools in biochemistry in which you have reflips, Okay, reflex RFLPs, in which you have PCR and in which you have radio immunoassay. Every year one or the other tool will be asked. And very importantly, now we have a protein synthesis, eukaryotic versus prokaryotic protein synthesis along with inhibitor. That's it. From biochemistry, UPSC Medical Science optional, the cycles, biochemical reactions are not important. Okay, only organ function test, vitamins, tools and protein synthesis, 50 marks. So dermatology and biochemistry are the two high yield subjects, okay, which will give you good marks. Okay, so please be thorough with these. So biochemistry, as I said, simple. First thing is organ function test part. You have liver function test, you have kidney function test, and you have thyroid function test. From liver function test, what is jaundice? But here this is vertically integrated question. That means similarly in pediatrics you have neonatal jaundice or kernicterus in the syllabus. There you will be learning what is physiological jaundice versus pathological jaundice. Okay, what are the predisposing causes? Predisposing causes are prematurity, because liver is unable to handle the bilirubin because of its immaturity. Prematurity, one of the predisposing causes. There are other causes like delay in birth, normal delivery, caput succedaneum, cephalohematoma, internal bleeding, all these things. What happens because of the physiological jaundice? Patient might develop kernicterus and you have to give the manifestations or CNS side effects of the kernicterus. All these are very important. Now this is vertical integrated. Actually this should be a question from pediatrics, but every year I will see some 5 or 10 marks of the questions here and there. Because don't worry, anyway by the time you are writing this exam, both paper 1 and paper 2 are already revised by you. Okay, while you are writing exam in the final days, definitely it doesn't make any difference to you, but initially don't get panicked by seeing a question of physiological jaundice in biochemistry. But definitely this is organ function test, LFT part. That's why in our course, in our notes also, I gave you a medicine based approach to jaundice instead of a biochemical basis of approach to jaundice, because they might ask different. Because even liver hepatology section of general medicine also might carry an implication here. Okay, so that's why this integration is very important. But don't worry, if you cannot integrate also, 95% of the paper can be handled. Only 5 to 10% of the paper will have some bit of integration, which if you apply some common sense, you will definitely get the answer. So from jaundice point of view, there's several questions from 2002, 7, 2020, 2021. Okay, very soon I'll be updating the focus guide with including all the questions till 2022. Okay, so you can download it for free from the website UPSC Medical. You will find it there, all the questions and also what are the repeats. Now question number 2, as I said, protein synthesis in eukaryotes. What are the protein synthesis inhibitors? See, same questions from 1997 to 2022. There's several questions on the protein. What is post translational? What is post transcriptional modification? What is translation? What is transcription? What are the protein synthesis inhibitors and all? What is the energy requirement? And what is the role of tRNA in protein synthesis? These are all the things which are real. And next is, as I told you, from the tools of biochemistry, you have radio immunoassay. The same question with scientist name, Rosalind Yallow. It is very important whenever there is a tool in biochemistry or a tool anywhere, even in forensic medicine also, if there is a DNA fingerprinting. Okay, you have to give the inventor or the discoverer name. Okay, it carries a lot of weightage, and that is what the feedback I give while evaluating test series papers. Whenever these kind of questions comes, please write the name of the inventor. Now, what is the principle of RIA? What are the advantages and disadvantages? Was asked in 2017. It's a repeat question, straight question. And now we have explained the biochemical role of different derivatives of vitamin A. We did predict in this test series this year. Okay, this year subject-wise test series, we did ask a question on what are the vitamins of vitamin A, what is its role and all. It's simple. Vitamin A causes, clinical manifestations, management. Now, I want to tell you one point here. Like cranial nerve, 1 to 12, everything is important. Similarly, all the vitamins, vitamin A, D, okay, E, K, fat soluble vitamins, and vitamin B complex and vitamin C. You should be thorough with, very important thing is biochemical role or biochemical reactions which are catalyzed by these vitamins. You should be thorough with the required dietary allowance. What are the sources of these vitamins? What are the deficiency manifestations? And very importantly, how do you manage? When I look at the management part, many of the students in test series, they are only just saying that supplementation. If you just give supplementation, it's not enough. You have to give what is the required dietary allowance, what are the vegetable sources or the animal sources which are available, and what, when you give supplementation as a medicine, what is the dose and what is the time they should take this. All these management aspects in detail are not there in biochemistry textbooks. They are there in general medicine. So that's the reason in model answers of test series and also the notes, I have included the proper management from medicine point of view. So vitamin deficiencies and mineral deficiencies, diseases associated with them, what are the clinical manifestations and what are the causes of these vitamin deficiency, what is the biochemical role or function or what kind of biochemical reactions they catalyze. All these are important from nutrition, vitamin and mineral aspect of the biochemistry. And there is a vertical integrated component to this vitamin part, because in PSM we do have a nutrition part wherein every year there's lot many questions are coming. For example, last year or before last year there's a question on vitamin B12, and this year there's a question on iron. Okay, again you have to link this medicine part, PSM part and also the biochemistry part together, and that's how I frame my model answers in the test series. I give you everything at a single place so that you will have a knowledge of all this horizontal and vertically integrated content with you. Now describe the biochemical role of vitamin A, deficiency manifestations of vitamin A, and what are the forms and roles of vitamin A. It was repeated long back and it came back again. Okay, vitamin A. So we predicted this in the this year test series. Next is, as I said, organ function test. This year they did ask LFT and thyroid function test here. Okay, what is the diagnostic role of thyroid function test in the diagnosis of thyroid disorders? Again, this is thyroid function test. It is a vertically integrated question, because in medicine when we read hypothyroidism and hyperthyroidism, there you will understand why we do TSH and free T4, and if the levels are low, if the levels are normal. Okay, if the levels are high, based on that we have a sick euthyroid syndrome, we have hyperthyroidism, we have hypothyroidism, we have fictitious hypothyroidism. These kind of flowcharts or algorithms are given in those notes. So this is how you interpret thyroid function test. So next year you might expect kidney function test, serum creatinine, role of serum creatinine and complete urine examination or specific gravity of the urine, casts in urine, stones in urine. These kind of things can be expected in the future from the kidney function test. Okay, there are 3 organ function tests which are given in the syllabus: liver, kidney and thyroid. And even thinking that in the future they might ask some radioactive tests also. We have some future nuclear medicine scan tests available to look for the structure and functions of these tests. For example, for thyroid you have a thyroid scan, nodule, or hot nodule or cold nodule. What is the differential diagnosis from medicine point of view? Similarly, in kidney we do have different scans. Okay, MUG scan, renal scintigraphy, which is available from the kidney point of view. Okay, these are the nuclear medicine scans which can be asked in the future, predicting that these questions are included in the subject wise and grant test. Okay. And similar question from thyroid function test was asked in 2016. What are the biochemical findings in hyper and hypothyroidism, and enumerate the thyroid function test. So this concludes biochemistry. Pretty easy. All the questions are expected. Okay. Next is physiology. Very important. It carries 75 marks of the weightage, and from physiology also most of the questions are repeat. For example, you have growth hormone from endocrinology. What is the regulation of secretion and what are the physiological functions of growth hormones? Similar questions were asked in 2016, 18, 19. Okay. Now, what is the short term and long term regulation of blood pressure? Short term means baroreflex. Okay. And long term means, what is that? Renin, angiotensin, aldosterone system. That's a direct question from the test series this year. And functions of basal ganglia and Parkinson's disease, repeat again 2007 and 2020. Excitation, contraction, coupling in skeletal muscle, you should draw the image and explain it. Okay, very important question. Similar question was asked in 2020. It's a repeat. And explain the mechanism of iron absorption in the intestine. What are the factors regulating the process of iron absorption? Very important from hematopoiesis point of view. Similar questions were asked in 2007 and 2018. Now this iron, as I said, has both horizontal and vertical integration. Horizontal integration in the sense iron is a mineral which can be also asked in the biochemistry. Iron part is also there in the PSM as a vertical integration. Iron role in the blood or RBC synthesis is also there in the physiology. And iron deficiency manifestations in pregnancy from OBG point of view, anemia and pregnancy is very important. So that's why you should know A to Z about iron, how it is absorbed, how it is secreted, what is the RDA, why iron requirement increases in the pregnant female, what is anemia and pregnancy, what is its criteria. Okay, all these are very important from iron. Iron is very important mineral. Now, in the starting of the paper discussion, I told you that the stress reflex has unduly given lot of weightage of 15 marks. But again, stress reflex and inverse stress reflex were part of our test series questions, but weightage was only 5 marks. Now, you know the diagram if you are a part of the test series, what is the well labeled diagram of stress reflex. Similarly, what are the functions and clinical applications of stress reflex? What is the example of a stress reflex? It's a deep tendon reflex. So any knee jerk, what is its function? Okay, why do we do deep tendon reflexes? How they help in differentiating a UMN lesion from a LMN lesion? Okay, deep tendon reflexes are exaggerated in case of UMN lesion, or they are very slow or sluggish in case of deep tendon reflex. Pendular reflexes are seen in hypothyroidism. If you can just give the clinical applications, it's okay. What is the function of any stress reflex? Stress reflex will make sure that the muscle is not stretched to such an extent to prevent muscular injury or a muscle injury. So these are all the things, these are all the points you need to write in the exam along with the image. And yes, reflex is part of the physiology syllabus. You should know the definition of a reflex. You should know what is monosynoptic and polysynoptic reflex, and what is a stretch reflex and what is the inverse reflex, what are their examples, what are their functions, and what are their clinical applications. That's the reason in the test series, anticipating a question on this, I did ask a detailed question on plantar reflex this year. Plantar reflex, what is its function and what is its clinical application? This is what I asked, but instead of plantar they asked this patellar reflex. Simple, but overall you should be thorough with the different reflexes, their clinical implications. If you are regular to the clinical postings of medicine, you will definitely know what is the significance of deep tendon reflexes, because that's what we do for neurological examination or nervous system examination. Done. Paper 1 section A. These are all the different questions which are repeats. It's already been 25 minutes, so let me go a bit fast because otherwise people feel it as a boring session. But again, for any aspirant who is giving his 23-24, previous year paper analysis forms a basis or a pillar or a strong foundation, like how to go ahead and what are the key areas you should look at. Okay, so that's the reason I am just giving you all the details, but let me just speed up. Okay, slightly. Now you have pathology 60 marks. Questions were molecular mechanisms of carcinogenesis of breast carcinoma. What is the molecular mechanism? You need to know what are all the tumor suppressor genes which are involved in, what is the genetics which are involved in, how there is a carcinogenesis. Usually molecular mechanism of carcinogenesis of colon cancer was well studied, but because breast carcinoma pathology is there in the syllabus, this time they are asking you the molecular mechanism of carcinogenesis of breast cancer. So anyway, very soon all the enrolled video course students in the valid period, they will be receiving 2020 paper notes and also discussion videos, right? So therein I have clearly given what are all the molecular mechanisms which are important in carcinoma and what are the histopathological features of invasive carcinoma of no special type. So few of the students, they got confused. The problem here is question number 5. It's a must answer question, and now this question is a bit tricky. Why? Because we all know what are the etiopathogenesis of carcinoma, breast carcinoma? What is the histopathology of breast carcinoma? You know lobular carcinoma in situ and you know ductal carcinoma in situ. You know all these things. But problem here is the question is a bit tricky. Instead of just asking the etiopathogenesis, they are asking you molecular mechanisms. If you do not understand the significance, even if you give etiopathogenesis, mostly like you will get 3 out of 5 if you clearly give what is the etiopathogenesis. Similarly, if you don't know what is invasive carcinoma of no special type, it is nothing but the invasive carcinoma of no special type is nothing but the most common entity, that is the ductal carcinoma in situ. So even if you do not understand that, you can give all the things, lobular carcinoma, ductal carcinoma, everything, like whatever you know, even if you give all the histopathological variants, one will match it together. Now this speaks about framing a question in a trickiest fashion. Even if you know the whole of the answer, because you cannot understand the terminology, you will be confused. Okay, I had a similar incident during my second MBBS in forensic medicine exam. All my fellow mates or students were confused on the day, because there was an essay in the theory exam, final exam, which says what is ophiotoxemia. Okay, ophiotoxemia. What is ophiotoxemia? Because we don't know that, we left this 20-mark question. But this ophiotoxemia means snake poisoning, which is very important question. So this is what happens if you do not understand the exact term. So that's the reason when you start reading any topic, you have to give an introduction and you have to read about it. Then you will understand. So that's the reason histopathological feature of invasive carcinoma of no special type is nothing but the ductal or lobular carcinoma in situ. I'll give you the detailed notes, okay, in the 2020 notes. But what I am trying to infer is, just be wary of the different synonyms. What do we say? Synonyms. Though you know the answer, because you do not know the synonym, you will be confused. Okay. So breast carcinoma is very important in both pathology and also the general surgery aspect. There was the similar question in general surgery also this year. Okay, carcinogenesis, molecular mechanisms, histopathological features, 2010, 96, 2004, 2008, similar questions were asked. Now define granulomatous inflammation. Okay, describe in brief different types of granulomas, very important, and it's a frequently repeated question, 98, 2002, and it is a part of the test series also. Now, from inflammation point of view, in future you have to look at the acute inflammation, what are the chemical mediators of acute inflammation. But in the last 4-5 years, I could see only questions from chronic inflammation. Last year there was a question on chronic inflammation, what are the mediators of the chronic inflammation, and there are also questions on granulomatous inflammation now. Okay, just focus on these 3 areas, very important. Now, rheumatic heart disease. See, rheumatic fever, rheumatic heart disease incidence has come down. When I was in MBBS, it's a golden question, rheumatic fever, because that time India was still developing, and in underdeveloped and developing nations, because of the streptococcal sore throat, the incidence of rheumatic fever was, or rheumatic heart disease was high. But now incidence has come down, but again, because it's there in the syllabus, they're frequently asking this question starting from 2010 to 2015. Now, what is the pathogenesis and histopathological features of rheumatic heart disease? Very easy, molecular mimicry is the one, and histopathology, you know what is that, Askov bodies and Anichkov cells and all, right? So you have to draw the images, and very importantly, from pathology point of view, what I want to tell you is, your paper is incomplete if you do not have HPE or histopathological examination images. Okay, if you do not carry hematoxylin and eosin penicillin, you can at least use a pink and blue sketches to draw the images, and HPE images are must if there is a question on histopathology. Now, enumerate 2 important causes of cirrhosis. Cirrhosis is there in the syllabus, and it's asked in 94, 2000, 2010, 2003, 2020 also. And what are the histopathological features of this? Okay, nodules and fibrosis are the 2 important histopathological features of this cirrhosis. Very easy question. And yes, difference between benign and malignant tumor, and what is the pathogenesis, and what is the role of HPV, what is the role of E6 and E7. This is a direct question from our test series this year, and it got repeated, and you have similar questions ranging from 2007, 195, 2004, 2003, 2012 and 2011. Different questions. Carcinoma of cervix is the one question which was repeated, and there are many questions on differentiating between benign and malignant tumors. And similarly, they can ask you what is the difference between primary and metastatic tumor. Okay, primary and metastatic. Benign versus malignant, primary and metastatic are the 2 areas of neoplasia, the basic questions which were frequently repeated. Now you have 7B2, describe in brief pathogenesis of type 1 diabetes mellitus. Yes, it's a repeat. It's from 2009, 2018 and 2020 also. And what are the 2 important glomerular regions of diabetic nephropathy? It's a straightforward questions from our subject wise test series. Kimmel-Stein-Wilson nodule, right, is the characteristic lesion of diabetic nephropathy. Similarly, there are different glomerular lesions which were clearly discussed even in video course also. Diabetic nephropathy, diabetes mellitus, diabetes mellitus is very important from pathophysiology or pathology aspect. Physiology aspect also it is very important because pancreas is there in the syllabus. Pharmacology also it is very important because anti-diabetic medication, both oral and also insulin, is very important. Similarly, diabetes mellitus is important in pathology because you need to understand the pathogenesis of diabetes mellitus type 1 and type 2. In general medicine also it is very important because there was similar 20-mark question in general medicine this year itself on lifestyle measures which help in managing diabetes mellitus, and very importantly the complications of the diabetes mellitus, acute and chronic. In that, diabetic ketoacidosis very important, chronic renal, you have diabetic nephropathy, diabetic autonomic neuropathy, everything is very important. Complications of diabetes mellitus, because 1 out of 2 in the age group of diabetes are facing this issue, and it's a chronic disease and it should be addressed. So that's the reason there's a lot of weightage given to the diabetes mellitus. So that's the reason there's a question on pathogenesis of type 1 diabetes mellitus and what are the glomerular lesions. So this is a pathology question. Now we're done with the pathology. Let's quickly jump to pharmacology. There's not many tricky questions from pharmacology, but what I want to tell you for the future is drug interactions are becoming very important these days. Interactions. Okay, that's the reason the whole of subject wise test this year, the test 3 pharmacology, is fully loaded with questions from drug interactions, because the trend is changing in the recent past. Even for usual questions, prototypical drugs also, they're asking questions on the drug interactions. So when you're reading any question or any topic from pharmacology, you should always think of what is the drug which can be given along with it and what is the drug that should be avoided along with this drug, because as a practicing physician you should know this, and drug interactions are the pillars, very important. Next is from antihypertensive drug, you have question number 5C, that is what are ARBs, what is the difference with ACE inhibitor, and what is the pharmacotherapy of hypertensive emergency. Straightforward question from our test series this year. Okay, describe indications, contraindications and adverse effects of ACE inhibitors. 2011 we have classification of antihypertensives. Yes, what are the advantages of angiotensin, and similarly describe the mechanism of action and adverse effects of vasodilators. The same, there was one more question on vasodilator, we'll come to that later. And what is the their use in hypertensive urgency or emergency, and what are the different classes of drugs used in treatment of hypertension, mechanism of action, clinical uses and adverse effects of the vasodilator, that is sodium nitroprusside. Very important question for 10 marks. Now what are the straight therapeutic indications, drug interactions and side effects of celecoxib NSAID? Okay, selective NSAID, right? Selective NSAID. And we have a chloroquine, the very old anti-malarial prototypical drug. Okay, similar questions were there in the 96, 98, 2001, 2011 on chloroquine, but celecoxib is new. Okay, realizing the importance of coxibs in NSAIDs, I did give so many questions on this selective NSAIDs. Okay, because the main advantage of using this coxibs is they have less effect on the mucosal or gut. Okay, they lead to less complications of GIT, but they were known to produce cardiovascular risk. Okay, if you are part of my course, either video course and test series, you do realize importance of these drugs. Now we did learn about the first line drugs used for the treatment of tuberculosis, which was a question from subject wise test again, but these days they are also asking the second line drugs. There are many second line drugs. Anyway, you will be getting the notes if you are a part of the course. What are the different second line drugs, what are the adverse effects associated with, where they are used. If you are not sure about the list of second line drugs, anyway we did discuss in detail about what is the management of MDR and XDR TB, right? Therein I did give you all the protocols or algorithms of how to manage a multi-drug resistant or a extremely drug resistant TB. What is the role of cycloserine, what is the role of all these drugs are clearly given. You can just enlist them. Okay, but just giving a list will not give you 10 marks, right? You should be able to give a little more on the mechanism of action and adverse effects associated with these drugs. Now again, what is the role of aldosterone antagonists as vasodilators? This question, even while designing the model answer for 2022 paper also, I found it a bit difficult, because usually what are the aldosterone antagonists? It is a spironolactone. Okay, it's a spironolactone. And why do we use a spironolactone? Yes, spironolactone is an antidiuretic. Okay, sorry, I'm so sorry, it's a diuretic. Okay, it's a potassium sparing diuretic. It is a potassium sparing diuretic, and its main use is in hypertension. It complements furosemide or hydrochlorothiazide, because these drugs, the thiazides and loop diuretics, they are associated with a complication called hypokalemia. Because it is a potassium sparing diuretic, spironolactone, it helps in that. So that's the reason in 2018 there's a question on mechanism of action, clinical uses and side effects. Similarly, this year again in 2022 there's a question on thiazide diuretics. But in the syllabus of UPSC prescribed one, anti-diuretics is given, but definitely they are asking many questions on diuretics, because diuretics are also antihypertensives, and antihypertensives is clearly given in the syllabus. So you should be well versed with all the diuretics, their mechanism of action, okay, therapeutic uses, side effects, drug interactions, everything you should know. Okay, everything you should know. But what is the role of aldosterone antagonist as vasodilators? They are definitely not vasodilators. I don't know, its question is a bit tricky. We'll come back to it later. Okay, if anyone of you know any reference or anything, just post it in the comment section. We'll definitely look at it. But I have given my own answer in my own perception in our notes. Okay, I'll be sharing that here. So what is the mechanism of action of metformin? Very important, oral antidiabetic drugs. And what are the adverse effects, therapeutic indications of thiazides? Yes, thiazides was asked in 2007, 2012, similar question, and also 2013, but in a different way, more of explain why kind of questions. This year we did miss this dictum term called explain why questions in pharmacology. The questions were pretty straightforward. So this concludes simple 50-mark questions on the 45-mark questions on the pharmacology. Now let's quickly jump to the microbiology part, which is for 50 marks again. You know, right, in microbiology includes immunology also. Okay, immune system, immunology will be there, and there will be some how many organisms do we learn in microbiology? In microbiology we have bacteria called meningococcus, salmonella, shigella. Okay, salmonella, shigella. Similarly, we have viruses called herpes virus, dengue virus, polio virus, HIV or AIDS. We do have this. And similarly, we have parasites like malaria, Entamoeba histolytica, and Giardia. And we also have fungi called Candida, Cryptococcus, and Aspergillus. One or the other organism gets repeated every time. For example, this year we got dysentery, Shigella 1. We have a question on dengue. We have a question on HIV and AIDS opportunistic infections. We have a question on giardiasis, and we have a question on Aspergillus. 5 questions on 5 organisms, right? So only from these organisms the questions will come, and you should be thorough with the lab diagnosis and also the diseases caused by, which includes the pathogenesis part. And little tricky thing to understand here is there is a vertical integration in microbiology. You also have infectious diseases part of medicine, wherein there are some microorganisms which are given in the syllabus. So those are typhoid, rabies, you also have AIDS and dengue. You have Kala Aza, Japanese encephalitis, and now you have tuberculosis. Now the problem here is, when student is reading all these microorganisms, you don't need to read about the prevention or the treatment, management protocol, complications of Shigella. From Shigella point of view, syllabus they gave what is the lab diagnosis and diseases caused by of the Shigella. But Salmonella is the cause of typhoid. And from medicine point of view, they are asking you what is the etiology, clinical features, diagnosis, management, and preventive measures of the typhoid. So typhoid should be dealt in more generalistic way, starting from the microbiological, biochemical reactions, cultural characteristics, lab diagnosis, diseases caused by the clinical manifestations, and also how will you diagnose it. Apart from serological diagnosis, what else tests you do, the blood culture part, any radiological examination to look for other complications, how do you manage, what are the anti-typhoid drugs, what is the pattern of development of resistance, how do you prevent it from typhoid point of view, is there any vaccine available, and what are the preventive strategies. So only diseases like AIDS, dengue, Kala Aza, Japanese tuberculosis, rabies and typhoid should be dealt in detail, Whereas these diseases, herpes, polio, malaria, Entamoeba histolytica, candida, these should be dealt only from microbiological point of view. So you should have that knowledge which a microbiologist will possess. Otherwise, the other organisms which are given in the syllabus of infectious diseases, you should have in-depth knowledge of etiology, clinical features, diagnosis, management, and preventive aspects. So that is very important. That's the reason I have clubbed all these three things in the test series as a test 1 microbiology. Test 1 microbiology includes microbiological organisms, infectious disease organisms, and also the immunology. So now let's get to the questions of 2022. Draw a diagram of IgA. What is its role in disease? Okay. Similar questions were asked in what are immunoglobulins, classify immunoglobulins, describe their role in host defense against communicable diseases, what are the modes which immunoglobulins act on antigens, explain the functions of each class of immunoglobulins starting from IgA. IgA is a mucosal antibody. It's a secretory antibody. It protects infections spread from the mucosal surfaces. Okay. What are opportunistic infections? What are the various bacterial, parasitic, viral, fungal? You know, right? AIDS defining illness. WHO stage 4 of the HIV is AIDS, right? In acquired immunodeficiency syndrome, what are all the opportunistic infections you expect are asked? Similarly, what are the dermatological diseases associated with AIDS, and what are the two important parasitic fungal infections can occur during HIV? So it's not a rare question, it's a repeat. Name two fungal, two parasitic agents causing infections in HIV patient. Describe the laboratory diagnosis of any one of them. 2007 question. So it's a repeat question. Now you have what is Giardia. Write the manifestations of disease produced by infection with Giardia and give its laboratory diagnosis. Now you have morphology life cycle of Giardia in 2015. Okay, the Giardiasis was asked in our test series also. It's a repeat. Why I'm saying the test series? That see, I have this 4 or 5 years of experience of dealing in 24/7 with UPSC Medical Science optional now. Okay, I can proudly say that I was able to predict some of the future questions, okay, which might help the aspirants to win the race, because you know the level of the competition we have and the difficulty level of the paper these days, right? So if you have some help from me, okay, if I am of any help to you, like, I'll be the most happiest person. That's the reason this time when I was setting up the paper, I was only thinking about more hits in the final paper, so that I do understand the importance of attempting a question already, right? If you have already attempted the question in test series, if the same question comes in the final exam, definitely you will get sent 10 out of 10, right? So that's how your score improves. Okay, so that's the reason I was just analyzing the previous year papers and setting up the test series so that there are more hits in the final paper. Okay, and that's what the comments I received after the exam from many of the students, saying that we were getting like straightforward direct questions from the test series, and it made the job easy. They were able to finish the test on time, and they were confident about the securing good marks in the medical science optional. Okay, so giardiasis was there in the test series of the this year's, okay, microbiology. And what are the dengue viruses? There's no question without dengue. Okay, very important these days. What are the different dengue viruses? What are the pathogenesis and laboratory diagnosis of dengue hemorrhagic fever? It's straight repeat, 2009, 2015, 2018. Aspergillus, as I said, infections caused by the laboratory diagnosis of pulmonary aspergillus. It's a repeat from 2018, and it's a part of the test series also. Now, what is dysentery? Dysentery every year. It's a dictum topic. It's a dictum topic from microbiology. Like how I said placenta, facial now, hip joint or knee joint are dictum topics from anatomy. Dysentery, there's no paper without dysentery. Okay, 2010, 2013, 2020, but somehow in few areas it gets repeated. Amoebic, you should be very careful whether it's an amoebic dysentery, that is Entamoeba histolytica, or it's a bacillary dysentery from Shigella. Okay, be careful. I have seen few students in test series, instead of looking at amoebic dysentery, they straight away gave Shigellosis, Shigella, or bacillary or bacterial dysentery. Okay, don't get confused. It's very important to read questions carefully. 10 or 15 marks here and there will keep you out of the list. Okay, you have to be very careful. Now it's already been 45 minutes, right? Let's quickly jump into paper 1 section B, forensic medicine and toxicology, part 45 marks. And what is a firearm? What are the features of firearm ammunition entry wound that help in determining the range and direction of fire? So firearm are forensic ballistics. Forensic ballistics is very important from injury part of the forensic medicine. Similar questions were asked in 95, 99, 2003, 2007, 2015. If you check the notes, it's clearly given how to determine the range and direction of fire. Okay, but what is more important is these basic definitions, simple definitions are the ones a bit tricky. Okay, every time when you read a topic, first close your brain, close your mind, and think about what is the definition of immunoglobulin, what is the definition of antibody. Anything which comes into your mind, you should be able to give. What is opportunistic infections? What is a firearm? You know, the basic are the main body of the answer, like what is an entry wound, what is an exit wound, what is the determination of direction. But if you don't know the definition of a firearm, if you are confused in the starting itself, if you give some definition which is not making any scientific sense, examiner will get a bad impression on you. Okay, he might not give you the send marks for you. It leaves a bad impact. Okay, that's the reason when you start an answer, you should by heart standard definitions. I think that's what the general feedback I give to many students, to by heart or memorize standard definitions, because the way you start your answer will leave a pitch, will leave an impact on the mind of the examiner. Okay. What are organophosphate compounds? Describe briefly clinical features, treatment, and post-mortem findings. So that's what I wanted to tell you. From forensic medicine point of view, there are two important things which are gaining, as I said, drug interactions is gaining importance in pharmacology. Similarly, post-mortem appearance questions and also IPC or legal sections are acts. IPC legal sections are acts. Post-mortem findings are very important. When you read any toxicology question, when you read hanging, drowning and all, focus on the post-mortem findings. They are gaining more importance these days. So OP poisoning from toxicology, I think if you want to predict one toxicology topic in India where agriculture is the prime source of income, definitely OP poisoning should be there, right? Apart from that, because agriculture laborers, they roam in the, or they work in the fields, snake poisoning or snake bites are the second common things. So these two are the questions which are pretty predictable in a country like India. Now similarly, OP poisoning is being getting repeated from 94 to 2022. Okay. Now what is drowning? What are the different types of drowning? It's a repeat again, 2014 to 2005. And this is a tricky question. Okay, this is the first time I think there's no PYQ, right? And this is the kind of almost the last question in the exam. People got confused. Now, why there is suddenly a question on hyoid bone? Because when you read strangulation and hanging, the hyoid bone fractures are commonly seen in strangulation and hanging. Hyoid bone gets fractured at different areas. Now they're asking you what are the various fractures of the hyoid bone, and they're asking you to draw a diagram of hyoid bone. I don't recommend you to get into so much of details in forensic medicine, because at the end of the day you have to score 300 out of 500, not 500 out of 500. If you keep on wasting a lot of time into getting into depth of all these kind of tricky or bouncer questions, it will waste a lot of time. And now I could proudly say, out of this, in this paper, except for 10 marks, all the remaining questions are PYQs and repeats. So why do you want to waste so much of time on just questions which are less than 1% in the paper? Okay, but this is a question from forensic medicine. This is there in the hanging strangulation part, the postpartum examination. You will be looking at hyoid bone to confirm the hanging, like is there any strangulation or throttling or manual strangulation or banstola, wherein you will see fracture of the hyoid bone at various areas. Okay, anterior horn or posterior horn. Okay, so this will conclude our discussion on paper 1 section A and section B. Pretty static, except from this 10 marker. All the questions were repeats and almost all the questions were covered in the notes and also the test series part of UPSC MEDICO. And hope I have given you some guidelines or strategy for the next upcoming exams. So what are the key areas to be focusing upon? Okay, just go through them. So now let's quickly jump into the paper 2 part. Paper 2 is clinical. Okay, and when I say clinical, these days the questions are being framed more in clinical pattern. There will be a clinical scenario and you are asked to manage it. So the management aspect has been given a pretty good weightage. Apart from that, in paper 2 section A, you have two subjects, general medicine and pediatrics. More important point from general medicine is the subsections or sub parts of general medicine, like dermatology is having 50 marks weightage. 50 marks weightage. As I already told you, the biochemistry and dermatology are the mini or tiny subjects which are high scoring with little or minimal topics. Similarly, from psychiatry and medical imaging, these days, though the weightage is only 10 to 20 marks, these 10 to 20 marks are being asked in the mandatory question. That is the first question. They are including these two subsections. That means these 4 or 5 little topics which are given in psychiatry, like schizophrenia, bipolar disorder, depressive disorders and all. And also from medical imaging, you have principles of CT, MRI, 2D echo and ultrasound. These 4 or 5 topics, you have to be thorough with them, because though the weightage is little, they are being asked in the mandatory section, so that you need to answer them. Apart from that, general medicine is pretty predictable, because there will be always questions from the thyroid and also the diabetes mellitus complications part, any kidney related question. Okay, these are the few questions which are pretty predictable. This year also general medicine is kind of predictable, but in 2022 there is a major issue from pediatrics aspect. Okay, because as I'm observing the trend, in pediatrics you have only 8 or 9 topics in the syllabus, 8 or 9. Every year they'll ask a question on diarrhea or diarrheal management. Every year they'll ask a question on acute respiratory insufficiency protocol or pneumonia, because these are the leading causes of death in under 5 children, right? Every year they'll ask a question on immunization or vaccination. 1 or 2 vaccines they'll definitely ask. So this is pretty straightforward. But this year they kind of went into such details, like instead of asking a core diarrhea question of plan A, B, C management, they asked question on dysentery. Okay, related one. They have given a clinical scenario on dysentery. They are asking you the management aspect. Similarly, there is a question on ARI pneumonia. It's predictable, and there is question on vaccination. But this time, they are asking definitions of herd effect. What is the vaccine efficacy? All these words are common in the news these days, because there is so much of development on COVID vaccines. You need to know what is herd immunity, what is herd effect, what is the efficacy of a vaccine. So these kind of questions they did ask, apart from a general question on classification of different types of vaccines: killed, live attenuated, component or conjugate vaccines, recombinant vaccines. So this is the trickiest part. Apart from that, there was one question in pediatrics in IMNCA guidelines. We did discuss in our video class about IMNCA guideline management of diarrhea, IMNCA guideline management of jaundice, protein energy malnutrition, almost every aspect, but we were only discussing it from 2 months to 5 years. Okay, but this year there is a question on 6-week-old suspected bacterial infection. Okay, suspected bacterial infection. So it goes without saying, because IMNCA is there in the syllabus. From IMNCA point of view, we were able to cover all the things which are related to 2 months to 5 years, but this time they asked less than 2 months wala suspected bacterial infection. I personally feel, unless you are a core PHC doctor who follows all these IMNCA guidelines, functional IMNCA guidelines, you will not be able to answer it. Like 9 out of 10 students will fail in answering it. It's a kind of bouncer thing, so don't worry if you haven't attempted it, because it goes into the choice part. Apart from that, the remaining questions are pretty predictable from paper to section A. So this is what I wanted to tell you. As we go forward for 23-24, focus more on IMNCA part of management of pediatrics. Also focus more on the clinical aspects in MCQs, okay, preventive aspects, and more importantly, if there is a diabetes mellitus hypertension questions, lifestyle measures or lifestyle follow-up is becoming more important these days. For the last 3 to 4 years, I could see what are the lifestyle measures for prevention of diabetes or prevention of hypertension. So do focus on those aspects. Okay, they are becoming more predictable. So some more things which are important I'll discuss along with the questions. Okay, so for the first thing is enumerate the imaging modalities used in diagnosis of cardiac diseases. Cardiac disease diagnosis, 2D echo, we did discuss in detail. Along with that, there were few questions in the test series which will ask you what are the variants of 2D echo, in what kind of cardiac diseases they are useful. Apart from that, you have a cardiac MRI. Okay, principles of cardiac MRI was already asked in one of the grand tests, and also there are questions on there are other tests like nuclear medicine scans which are done these days. Okay, nuclear medicine scans are being done to check the functional status of the heart. Okay, and CT angiogram along from the coronary angiogram, you have a CT angiogram which gives calcium score again, which is a non-invasive way of looking at it. I think these are the imaging modalities used in cardiac disease. What are the indications? So how they are useful and all, I'll anyway give you the notes with model answers. Just go through them. What I wanted to tell you from medical imaging point of view is, for the last few years from 2019, 2020, 2021 and 2022, every time in this mandatory part they are asking medical imaging question, and that too not a regular question on what is the principle of 2D echo, what is its diagnostic significance. These kind of questions, instead of asking them, now they are asking you particular thing about what is the role of ultrasound in management of liver abscess, right? Particularly under ultrasound guided, we do aspirate, okay, and reaspirate. This is the usual protocol nowadays. Even breast abscess also, ultrasound has got a role nowadays. In breast abscess, incision and drainage is not being practiced now. Under ultrasound guidance, there is a regular aspiration of the breast abscess going on. By doing this, it is less invasive, less painful, quicker and earlier recovery. Patient can continue doing breastfeeding. So these kind of specific aspects of it in particular disease are being asked nowadays. Now you will ask me, sir, then how to go ahead and prepare everything in a holistic fashion? Your role is not to probe into all these kind of things, but you have to act very smart nowadays. When you read management aspect of various diseases, therein you will anyway come across what are the different investigations we do. Okay, you have to club them together and present it like your answer. Okay, for example, abdominal pain, intestinal perforation, peritonitis, you will definitely come across various investigations done. In that, you have to define the role of ultrasound. So yes, it's becoming tricky, but again, you have to be ready with these kind of odd questions, and they kind of will be less than 5% of the paper. Okay, so that you can quickly jump back to the next question. Very easy, previous question, repeat question, 2016-2019. What is the pharmacological and non-pharmacological management of anxiety disorder? And we could predict it. It is a part of the test series, this question. And now treatment of nephrotic syndrome. Okay, renal disease, very important. It's very easy for just passed out MBBS student to understand how nephrotic syndrome is dealt. Okay, it is even important during our MBBS also. Etiology, clinical features, diagnosis and treatment of nephrotic syndrome in a 40-year-old. See, the causes of nephrotic syndrome are different in an young patient. In a young patient, most probably it is minimal change disease, but in age-old patients, it can be something else. It can be membranous granulopathy, right? It can be focal segmental. So you have to be very careful in this aspect of the diagnosis part. How do you do histological examination? Apart from that, etiology, clinical features and treatment, they almost remain same. Etiology point of view, it is more of not congenital, it is more of acquired variant. Acquired causes of nephrotic syndrome are more, and more common cause of nephrotic syndrome acquired causes are two: diabetes mellitus and AIDS. Okay, anyway, you will get an answer, model answer for this. Just go through them, but it's not a new question. There are many questions asked in this regard in 2007, 11 and 17 about the nephrotic syndrome part. Now, as I told you, lifestyle related measures are these things are becoming very important these days. There was previously in the last year itself, there is a question on how dietary factors influence cardiovascular health in adults, and try to highlight the specific cause effect relation. This is 10-mark question, and I did record a YouTube video on this question, and it has got less than, or I think it has almost got less than 1,000 views so far. But I don't think many have watched it in my YouTube channel. It is the least popular video, but I recorded it because this is very important in the future prospects. Okay, prevention of non-communicable diseases. India was able to successfully fight against infectious or communicable diseases. Now we are inching towards non-communicable diseases. The lifestyle measures are very important. That's the reason in 2020 they asked about how dietary factors. Now along with the diet they are asking what is the exercise related advice you give. Why I am stressing upon this point? Because it is very easy for a medical student to tell what diet to take and what are the exercise related, but for the same student or an aspirant to present it like an answer for 10 marks becomes difficult, because you might end up giving 4 or 5 points which will fetch you 4 or 5 marks. That's the reason you have to get into the depth, you have to get into the details. Okay, and this depth of prevention comes whenever your answers become more PSM based. That's the reason whenever a student comes to me for mentorship or counseling who is preparing for UPSC Medical Science Optional, I always tell him we need a preventive doctor, not a curative doctor. Throughout our MBBS curriculum, medical curriculum, we are being taught how to cure a patient, but we tend to ignore preventive aspects. But for civil service examination, they need a preventive doctor, more social doctor, social and preventive doctor they need. That's why in paper 2, most of the passed out MBBS students or non-MBBS medical graduates, they're struggling to get good marks because core concepts are good, pathophysiology is good, clinical features are good, management aspect in a curative fashion, in a tertiary care it is good, but all the questions from management, you take pediatrics, you take obstetrics, okay, apart from surgery, medicine, pediatrics, obstetrics, they are more of social obstetrics, they are more of social pediatric kind of questions, wherein you might end up not giving enough preventive points and losing marks. You might be performing well in paper 1, but when it comes to paper 2, your answer should be more in social and preventive way. That's why when I correct papers from paper 2, in the feedback, I always tell them, in the management, try to highlight the preventive aspects. For example, if there is a vaccine available for prevention, if there is a mosquito control measure which is available for prevention, if there is a lifestyle modification, dietary factor, exercise related thing which is available for prevention, try to highlight it, that you will get more marks in this. And always give a follow-up advice for any case which is asking you to manage. So many of the students, they only give direct drug dosage, that's it. They end up giving curative treatment, but they're not giving a preventive treatment. That's the reason every year there are more and more questions on the preventive aspect. So if you are well in touch with the preventive aspects of all this, you are tend to score more good marks in paper 2. Okay, take it as a dictum as you go forward for 23-24 paper. Okay, and as I said, it's a repeat again, ischemic heart disease prevention, there's lifestyle advice what you give. It was asked in 2019 and even in 2004 also, what lifestyle measures would you suggest? Overall lifestyle measures suggestion is easy, but diet and exercise you have to elaborate. Now, say this question is again a repeat. What are the complications long term and short term? And insulin dependent diabetes mellitus, patients are prone to develop DKA, diabetic ketoacidosis. So if you can outline the management of diabetic ketoacidosis, it's well and good, and it's a part of our test series. We could predict it. Now, this question again from general medicine, this is endocrine point of view. We did ask what are the cardiovascular manifestations seen in hypothyroidism in our test series, and how do you manage a case of hypothyroid coma. And we also did ask a question on management of thyrotoxicosis in the test series. If you can just write all these things, you will definitely get more than 70% out of it. Okay, so they have given you a clinical picture of hypothyroid. They are asking you what is the treatment, what are the cardiovascular manifestations, what is the pharmacological management, what are the blood investigations or thyroid function tests what you perform. If in the biochemistry itself, you know what are the thyroid function tests and how do you interpret TSH, T3, T4 in a case. Okay, how do you follow these kind of cases? So similarly, from thyroid point of view, hypo and hyperthyroidism, there are many questions from 97, 2011, 2018, 2019. Okay, so paper 2 section A, we are now into the dermatology point of view. Yes, derma, there are few or limited topics. Okay, you have lichen planus, which is frequently getting repeated, and you do have dermatitis. dermatitis or eczema. Dermatitis or eczema. And you also have very important one, drug related reactions like Steven-Johnson syndrome. Let me call it as erythema multiforme, no, or we can call it as erythroderma, okay, toxic erythroderma. Now this toxic epidermolysis necrosis, right? And there are many questions from these topics, and you also have scabies, okay, you also have vitiligo. Out of these 5 topics, every year 4 topics are getting repeated, okay. 6 topics. There is a psoriasis, okay, I might be missing one more, but okay, let me just deal with this. Lichen planus was asked this year. Dermatitis was asked. So with regards to dermatitis, it is very important that a student should be able to differentiate a contact allergic dermatitis from an irritant allergic dermatitis. Okay, this is one important thing. A student should also know what are the different variant dermatitis. So this year they asked about diaper dermatitis, diaper rash, diaper dermatitis, which is an irritant dermatitis. So you should be able to differentiate a contact allergic dermatitis from an irritant allergic dermatitis. So this is one important thing. And what in our test series itself and also in the grant test, I did ask you various allergens in the Indian community which might lead to dermatitis. For example, they can give you a scenario of a cement worker, or they can give you a scenario of a woman who is wearing bindi. Okay, so these kind of clinical scenarios are there. Okay, what are the allergens in the Indian community which might lead to allergic or contact allergic or irritant allergic dermatitis? This is the second aspect. Third aspect is patient who is an anti-epileptic suddenly developed a drug-induced reaction. You should be able to differentiate from a drug reaction from a Steven-Johnson syndrome, okay, based on the body surface area, based on the clinical presentation and all. This is one question which was asked. And scabies again is a usual routine, okay, itch, mite, scabies. They might ask questions on vitiligo and psoriasis, but which were not asked this time. So the weightage is good, huge, okay, and most of the these things are predictable. Now you have what are the modes of transmission of scabies, what is the mite burden in the initial infection is okay. Norwegian scabies or crusted scabies, it's okay, it's in almost in millions, okay. Initially you have 5 to 25 mites, but I don't know what is this in reinfection. Maybe a person with reinfection will be an immunocompromised person. Maybe the count will be in between 5 to 25 to millions. But I did check various references from various journals and also standard textbooks in dermatology. They haven't given about reinfection anywhere. Okay, there might be some confusion here. Now describe the distribution of cutaneous findings in scabies. You know the circle of Hebra. Okay, we did discuss in the class. So this question is pretty predictable from scabies 2004 2021 also. They did ask a question on this. Now you have lichen planus. What is 4 P's of lichen planus, and what are the common sites of involvement? What is Koebner phenomena? Straightforward question from our test series. What are the disorders in which you see Koebner phenomenon? And again, lichen planus has been frequently getting repeated from 2013, 17, 20 and 21. Now following an acute episode of diarrhea, 3-month-old wearing diaper, diarrhea is a triggering factor because stool will cause irritation. So it's a irritant dermatitis. What is the clinical picture and how do you manage it? Diaper rash. It is kind of horizontally integrated one. Even in pediatrics also, you will see patient with diarrhea developing diaper rash. There was this Nina Khanna's dermatology part in OPGI. Okay. Even last year also there was a question in dermatology which is straight away taken from the OP guide. So they're trying to link dermatology part of derma can be both from general medicine and derma can be from pediatrics, right? Many of the conditions. Now from peds point of view, they're trying to link dermatology. Peds point of view, they're trying to link dermatology together. So do check dermatitis part of pediatrics also while preparing, okay. And this part of the textbook in the OP guide, there is Nina Khanna's dermatology segment. That segment is given by the famous author, okay. So this is how they linked. But again, at the end of the day, if you know that it's an irritant contact dermatitis, you can definitely answer this question even without having a lot of pediatric knowledge, okay. So again, epileptic patient, lamotrigine, it's a toxic epidermolysis necrosis, okay. and it can be Steven-Johnson syndrome also. Okay, a part of Steven-Johnson syndrome. They're asking you differential diagnosis and how do you manage this condition. Same thing, Steven-Johnson, 1917, 2014, 2019. Same thing. Carbamazepine was given last time. This time they give anti-seizure drug like lamotrigine. So this is done. Dermatology, pretty easy. Steven-Johnson syndrome, diaperdermatitis, lichen planus, and scabies. So see, out of the 6 topics, every time 4 topics. Maybe next year, because vitiligo and psoriasis were missing, first start revising these 2 topics, then get into the already asked ones. But always a dictum was scabies and dermatitis. They'll always be there, okay, in the exam. Now pediatrics, students felt it a bit tough in comparison to all the subjects. Pediatrics was tough because people are not following IMNCA guidelines. People are just blindly giving treatment based on the curative approach, what when many of the MD pediatric students or aspirants does. See, this is very important. Recently, I had a conversation with one of the doctor who is pursuing MD pediatrics. So doctor's intention was to leave pediatrics from my course and go ahead with the rest of the subjects because he or she is already pursuing MD pediatrics. So the student did have a confidence of approaching it. But what happens is, I had a similar experience with an old student who was also MD pediatrics, but he ended up scoring not very good in pediatrics. The reason being, when you practice pediatrics in a tertiary care center, you will not follow all these IMNCA guidelines. You end up giving curative treatment which is given in Nelson's test book of pediatrics, or at least OPGI of pediatrics. But here, the questions are pretty specific, IMNCA based and also social pediatric based. Okay, they're social pediatric. They're basic questions. So it is always important to go through these aspects of preparation also. Okay, this is very important. Now a 3-year-old girl, ideal weight, history of loose stools mixed with blood and mucus. So it's a case of dysentery. Most of the times dysentery in this age group is bacterial dysentery, that is Shigella. Okay, she is active and feeling excessively thirsty. Okay, she is dehydrated. So there is some loss of skin turgor also. So then complete your diagnosis. Yes, there is dehydration. There is some dehydration in this case, not severe dehydration. So the patient should be started on plan A or plan B as per the IMNCA guidelines. Now, complete diagnosis is acute dysentery with dehydration. Most common organisms are, you already know, life-threatening complications which can be expected in a case of bacterial dysentery. I have given you a list of 6 or 7 in the 2022 model answers. That you will definitely get to know what are all those complications and how do you manage. Also, you will get a management algorithm there. Now, this is almost, even if you do not know about the specifics of the dysentery management, if you are already well versed with the area management, you can just go ahead as per IMNCA. You can classify into plan A or B or C, start giving ORS and manage the child accordingly. And similar question was asked in 2009: definition, etiology, importance of dysentery, clinical features and complications of dysentery, and how will you manage. And also similar question about the same loose motions mixed with blood clinical scenario was also asked in 2013. So the patient also has some dehydration here. So almost it's a indirect question from this. So if you're feeling that this question is pretty new, no, it's already been asked in 2009 and 2013. And this is the importance of this particular session. Why I am recording this? Because though the question structure is a bit tricky, it is always an indirect ramification of a previous year question. So if you are ready with most of the PYQs, you are ready for this exam. Now give 2 examples for each of the following types of vaccines used in under 5 child. I was telling you at the starting of the session that there were questions on immunization. They did ask you what are the different types and also these terms which are in the news nowadays: herd effect and vaccine efficacy. So this question is from vaccination point. So next what do we have is a 2-year-old unimmunized boy, okay, weighing 6 kg. So weight is also less, presented with fever, cough, difficulty breathing. So we are going in the lines of pneumonia, which is in the syllabus. It can be a bronchopneumonia. Now here what you have to do is you have to follow an ARI protocol, and you have to diagnose the case, and you have to manage accordingly. From the ARI protocol point of view, there are few important things. There is severe chest indrawing and nasal flaring, which indicates very severe pneumonia. Even the respiratory rate is too high as per the age. There is tachypnea and SpO2 is low. Patient needs to be admitted or referred to tertiary care center. And when you auscultate, there is bronchial breath sounds and bilateral crepitations. So this is a case of severe pneumonia. And what are the complications of pneumonia? It's already given. How do you assess the severity? ARI protocol you already know. And how do you manage pneumonia? What is the general management? What is the specific management is already given in the pediatric note, and we did discuss this in detail. A pretty easy question. Now, a 22-year-old primary mother comes to you with complaint of not enough milk. Due to this, her baby remains hungry and is consistently biting, and there is a sore nipple. Now you see, breastfeeding point of view, okay, in pediatrics there is a syllabus. In the syllabus we have a breastfeeding hospital, okay, sorry, baby friendly hospital initiative is there in the syllabus. And in the recent past you might have seen many questions in the breastfeeding point of view, and there was recently a breastfeeding week which got celebrated. Okay, so anything related to the breastfeeding is very important. That's the reason this question was asked in the subject wise test pediatrics this year. Okay, what are the 4 criteria for correct positioning and correct acceptance? You can go and check the model answer if you're a part of the test series. We did anticipate this question, but we were failed to anticipate this sore mother. How will you classify and all? This is the straightforward lines taken from the OPGI. Okay, this question is framed from that. Management of the sore nipple. And what is not enough milk? How will you confirm whether the baby, if you're a female aspirant, if you already have a baby, you can answer it. If you had a pediatric posting, or if you have attended OP also, you can answer it. If someone says not enough milk, how to go ahead, and what are the different causes of not enough milk, how to confirm, okay, how to manage. It's a generalistic way. It's easy for a practicing person, but if you haven't done also, it's okay. Okay, this question is kind of a bouncer question, pretty unexpected one. Yeah. Now, yes, the one more thing, as I was telling, IMNCI, everything from the OP guide, the last few pages. I am going to record a separate video on IMNCI in the course. I am working on it as per the latest 2018 modification. You will get everything from 2 months or less than 2 months and 2 months to 5 years. Every protocol, let's try to discuss in detail. Somehow, my gut feeling was saying that there will be some different questions from IMNCI. That's the reason this year in test series I asked about functional IMNCA. What is this new thing? What are its components? What are the packages and all? Functional IMNCA is an extension to the IMNCA. I did anticipate that. In the recent past, in the groups also, I did share a lot of information about what are the changes in the IMNCA. But I couldn't anticipate this thing, that people, they will go and ask something which is not very important, that is less than 2 month old suspicious bacterial infection, and weightage was also too high. But good thing is it is not the mandatory part of the question, so definitely you can leave it, the 4th question part, because it's almost carrying half weightage of that question, and many had done that, they left this question. But let's not underestimate IMNCA. So I'll be uploading a detailed 2 to 3 hour detailed video on IMNCA for the future exams. Okay. Now this is done, the paper 1 section A. Looks tough on the outlook, but if you can understand, and if you have done the previous year questions well, if you are part of my course where we did discuss a lot of these things, I think this becomes pretty easy. And many questions are from the test series, right? And you only need to answer 2 or 3 questions out of it, not everything. Now let's quickly jump into the next part, that is paper 2 section B. Paper 2 section B, the 3 subjects as I told you. You have general surgery, you have PSM, and you have OBG. OBG includes family planning. Now in general study, general surgery, yes, there is a question on varicose veins. Recently in the last year, I did share clinical examination points of breast carcinoma or breast examination, and also the peripheral venous system. Therein I did give you what is the inspection, what is the percussion test, what are the special tests which are done in varicose vein. The same question they are asking it here. Hope you're covered. Okay. So what is your take home is, from general surgery point of view, in the investigations, that Das textbook, we have a K Das book, right, for the surgery practicals. In that, the evaluation part of peripheral venous system, arterial disease, and also the breast are important, and there are questions asked in that regard. Because from breast point of view, they're asking what is triple assessment, which includes clinical examination. Similarly, any general study question, they'll not ask you how do you investigate. They'll ask you how do you evaluate. Evaluation should include examination part. Okay. So name the clinical test. What are the complications? We did discuss in detail. What is the management of? Specifically, they asked venous ulcer. So any chronic ulcer, how it is managed, they're asking. Okay. We have Bisgard's method for management of the venous ulcers. I'll give you in the discussion of the 2022 paper the details of it. But varicose veins is an important topic, and there's many questions. What are the complications of varicose veins in 94? Pathogenesis of the ulcer. How do you manage recurrent ulcer and the medial? Did ask you about that. We also did discuss about the management of chronic ulcer in diabetic foot also. Okay. What are the causes of chronic ulcers? Clinical features and management of varicose vein in right lower limb. So there's so many questions even in 2018 also from the varicose veins point of view. Now question number 5B, a 65-year-old male casualty with acute retention of urine. I have already give you the management algorithm for acute retention of urine. Okay, just go through it in the notes. The similar question from 2015, 17 and also in the 1994. What is the treatment of ileocecal TB? Last year itself in 2021 we did update. I gave you updated notes and updated discussion of ileocecal TB in detail. Okay, so it was asked now. Okay, I was very happy. 2017, 2015, 2010, 1999. The question is important because India without TB. There should be a question on TB. Okay, granulomatous inflammation was there. Second line anti-tubercular drugs was there from pharmacology. Management of ileocecal TB was there from general surgery. See, almost 3 questions from the TB. TB, diabetes. TB, diabetes, very important. CS cervix was very important. Rheumatic heart disease in a country like India. See, the syllabus itself is more India specific. Now next question is pain in right upper abdomen, female, fat, 40, signifies gallstones. We do have a detailed discussion on gallstone and acute cholecystitis management. Everything was asked. So 12 marks can be answered. This is rare. In the complications part, I did mention that Mirizi syndrome is seen, but how do you investigate and manage it? I think this is kind of bouncer question, because these days even complications are being asked of a disease. For example, you see varicose veins, they're asking you management of venous ulcer, which is a complication of varicose veins. Similarly, if you take gallstones, in the gallstone there are 7 or 8 complications. They're asking you how do you manage a specific complication of that particular that. So in the future prospects, whenever we discuss something, we'll try to also give you how do you manage a complication of a particular disease. For example, if there is a peptic ulcer, perforation is a complication of peptic ulcer. I should also tell you how peptic ulcer perforation is managed. So these kind of extension is very important for general studies point of view, general surgery point of view. So in general surgery, as we go forward, let's also try to learn the complications. Let's also try to learn the complications of the disease, not just the enumeration of the complications. Let's try to look at how do we investigate and manage them. Okay, kind of how do you manage a complication of a particular general surgery related disease. Now the next question, very important one, right breast 6 into 4 centimeter lump with nipple discharge in age 60. Okay, it goes without saying, you have to take a breast lump, you have to evaluate it, because age is 60 years, 9 out of 10 times it's a breast carcinoma. You know how do you investigate breast carcinoma and how to perform modified radical mastectomy and what are the important structures that are to be preserved. It's already there in the notes, everything. Okay, and it's a repeat. CA breast is an important question, 2010, 13 and 2018. So we're done with the general surgery part. Let's quickly jump into paper 2 section B, that is OBG, including family planning. It carries 70 marks weightage, and very importantly, outline the management of 35-year-old multigravida who has presented to the emergency in a state of shock. okay, multigravida, and she has delivered a dead baby at home 2 hours back. Placenta usually delivers within 30 minutes. Now it is 2 hours. Okay, so it's a retained placenta. Placenta hasn't been delivered, and the most common presentation of a retained placenta is obstetric shock. Obstetric shock because of PPH. If placenta hasn't been delivered, uterus is not contracting well. If uterus is not contracting well, patient will develop postpartum hemorrhage. Now here in this question, you should give differential diagnosis of an obstetric shock. You should give management of retained placenta and PPH. But first you have to start with managing the shock. So before giving any investigation, first resuscitate the patient, A, B, C, D, E of a patient. Okay. She has a previous history of lower segment cesarean section. So previous history of LSCS is a risk factor for adherent placenta, which can be a reason for the retained placenta, adherent placenta. So you have to think in all these lines and present your answer. In the algorithm will be given to you in 2022 notes very soon. Enumerate the contraindications which limit the usage of OC pills. Contraindications, there will be absolute and also relative contraindications. This is for 5 marks, very important. Similarly, in 2010 and 2016, they did ask these questions. Now, discuss the causes of failure of sterilization procedure in males and females. It's a kind of tricky question because OC pills, IUDs, and sterilization. These are the 3 aspects which are there in the syllabus. In the sterilization, you have a male sterilization, that is no scalpel vasectomy. You have a female sterilization. Most commonly done is laparoscopic clips, right? Okay, clear. Now, what are the different causes of failure of sterilization? Failure of sterilization in males is given in PSM Park textbook, but female it is nowhere given. I went into some of the recent studies which have been done, and I have collected few of the causes. Okay, I'll give you all these details in the 2022 model answer. Now define preeclampsia, very important, hypertensive disorders in pregnancy. What are the risk factors? What are the signs and symptoms? What is the management? Definitely it's completely covered, and preeclampsia is a part of our test series question. Okay, even contraindications of OC pills is asked in the test series. Okay, retained placenta management, PPH management is a part of test series, test 8 OBG. Okay, almost every question is there in the test series. And yes, HRT. What are the current consensus? Similar question in 2021. The same answer can be copy pasted here. What are the merits and demerits of HRT? It's given beautifully in 2021 paper discussion. Just go through it if you have 2021 paper discussion by UPSC Medical with you. Now, this is a rare question. I found it tricky because it's an unexpected question. It is similar to serious bacterial infection, IMNCA pediatrics question. Similarly, it's 15 marks. What has been the impact of HPV vaccination in India? Currently available HPV vaccines, because this is more in the lines of prevention of CA cervix. Okay, in that we have a HPV vaccination, Cervarix and Gardasil. It is bivalent, it is tetravalent. But recently in India, we got a new vaccine for HPV, which is much cheaper. Okay, I'll also give you the name of the vaccine and the schedule in the notes. What is more important is you can definitely answer this with the background knowledge. It is in the news, the new vaccine developed by India. But what has been the impact of HPV vaccination in India is a kind of current affair related one. Okay, even in PARK also this is not there. Even in any of the standard textbooks it is not there. But when you think of the impact it creates, definitely in the screening part HPV vaccination has a role. If a person is vaccinated, how will it impact the pap smear and all? I have collected some information from the research journals. I'll put it there. So in the exam you can happily leave it if you can, or if you have already read a similar heading in any of the Hindu paper for general studies, if you have content available, you can go through it. Otherwise, read my notes, which I'll definitely give you in the future. Now, HPV vaccines and schedules, you'll anyway get it in the notes. Now, final part is paper 2 section B, preventive and social medicine for 60 marks. State the national guidelines on feeding of infant and young child. Okay, national guidelines. What are the goals which these guidelines strive to achieve? Altogether bonzo question. There were national guidelines, but they are not recent. They are somewhere around 2014 to 2018 ones. Okay, these national guidelines. They are given on the feeding of infant and young child. It's from Park textbook, direct lines. Okay, I have copy pasted it into the model answer. Just go and check them. But it's not a repeat, and it's a mandatory section. I think many of the students found it difficult. Okay, in general, you can approach this: how to feed an infant and an young child. For example, first 6 months exclusive breastfeeding should be done. Okay, exclusive breastfeeding. From 6 months to 2 years, she should continue breastfeeding along with the supplementary nutrition, and food should be given from the kitchen, and the protein, the fat content should be taken care of. Okay, these are the few important things which are again there in the national guidelines. Okay, you might find that these are simple and easy, but these are the national guidelines what we were learning all these days. Okay, but just by looking at the question in the heat of the exam tension, you might forget this, you might leave this question. It's okay, you can leave this 10 marks as you did for that serious bacterial infection part of 15 marks, and also there was one question on 10 marks in the paper 1. So these are the three things which are outliers. Three, they carry 40 marks out of 500. The remaining 460, okay, the remaining 460 are pretty easy and PYQ based, so don't worry. This exam, you have to still approach syllabus specific PYQ centric fashion. Don't worry about 2 or 3 odd questions and start having stigma that whatever we read is not coming in the exam, only outliers are coming. So when you write an exam, your brain will only be thinking about that thing which you don't know. After coming out of the exam hall, you might think that everything is out of the box. Not everything is out of the box. Hardly 40-50 marks is out of the box. The remaining is all is PYQ centric. Okay, yes. Now, what are the objectives of investigating an epidemic, and what are the various steps you take in investigating an epidemic? The same question from PSM test series this year. We could predict it in the subject wise test, and even 2 or 3 students were happy that, sir, it is a direct repeat. They did message me after the exam. Okay, investigation of an epidemic. What are the objectives? Again, as I told you in the initial part of the discussion of paper 1, iron is very important. Iron comes in different places. This is PSM part of iron because iron related programs are there. Nutritional anemia prophylaxis program. You have 2 marks, 4 mark question on what is the content of iron, what are its functions of the iron, and what is anemia mukt bharat strategy. National nutritional prophylaxis program, anemia mukt bharat program, they are all discussed in detail and covered in test series as well. Now, NDTB strategy. Very important. If there is no TB, there's no paper. The various areas TB has come. Now, even in PSM also, India has taken a pledge that instead of 2030, 2025 itself, we are going to end TB. That's the reason there's so much stress on the end TB strategies. There are new policies like Nikshay Mitra. Okay, next year they might ask questions on this. New policies on Nikshay 2.2, Nikshay 2.2, Nikshay Mitra. And there is a Nikshay Poshana Yojana, and there's a concept called TB champion nowadays, adoption of a TB patient. All these are TB champion and Nikshay Mitra. It's an adoption program. These are all important upcoming developments which can be a future prospects. Okay, India is trying to end TB by 2025. There's so much of work going in the lines of tuberculosis. Okay, NTB strategy very important. So done. This is as simple as that. I felt, though, from the outlook when I just looked at paper 2, I found it that there are some tricky questions, but when I went into the research analysis and model answer is also almost ready, you will be getting it in a couple of days after posting this particular video in the YouTube for all the valid course takers. There will be discussion which follows. Now this time I have decided to discuss, upload video discussion of 2021 plus 2022 paper together in a subject wise fashion. Okay, in a subject wise fashion will be uploaded. So now this will be 2022 paper will also come into the combo course. Similarly, as we did, test series contains 8 subject wise tests, 3 grand tests and 1 live grand test. Overall 4 grand tests are already there, and most of the questions are designed in a futuristic fashion, predicting what could be the future trend. Okay, for some of the students you might feel that exam subject wise tests are a bit tricky and a bit tough. Voluntarily and intentionally I have raised the standard of the paper so that in the final exam you feel a bit comfortable by looking at some odd or bouncer questions. Apart from that, many of the questions are previous year question centric and nothing out of the syllabus. Okay, I can proudly say and confidently say that There's nothing out of syllabus in whole 500 marks. So don't worry. So your preparation should be syllabus specific, previous year question centric, and that's how I did design a course. And it is not over until it is over. Okay, while watching some videos and looking at my notes, you might feel that few aspects or few connections are missing, but you will definitely connect them when you start writing tests. Okay, that's the reason combo course is ideal for any aspirant who is going for 23-24. And with this video, whatever I did tell you, what are the future prospects, what are the expected areas you should be focusing upon, do focus on them, and all the best for the upcoming exam. And there are details in the slide itself. You can contact me on the number given. You can WhatsApp me, or you can email me on the registered email which is provided here. Okay, so all the best for the future prospects. Take care.